My name is Dr.Ebba. I'm an Ethiopian-American pediatrician. Currently, we're located in Jacksonville, Alabama, which is about an hour between Atlanta and Birmingham. It's a little bedroom community. I was born in Ethiopia. I came in after high school. I was about 18, coming from a third world country, even though I had a good life, sheltered life, and a good education coming from Ethiopia to New York. Was very, I wouldn't say traumatic, but very different, to say the least. And just trying to figure out the best way I can help was to do what I do best, which is to take care of kids. Talking to the health professionals and pediatricians and visiting different hospitals and individuals, I felt like I could make a bigger impact instead of just volunteering on an individual basis for a week here and a week there, which is okay. I thought I would make a bigger impact if I help mobilize resources and individuals to build a hospital, the Children's Hospital. Fortunately, for a country of about 85 million now, there are no freestanding children's hospital. And out of that 85 million people, more than 40% are kids under 15. You can imagine the magnitude, the sheer magnitude of needs in terms of the pediatric population. For that large number of population, there are only 200 pediatricians in the whole country. To make matters worse, out of those 200 pediatricians, only 100 of them are actually practicing medicine. I know that's very idealistic to think that you can make a huge impact and a difference, but that journey starts with one person, one idea. Maybe many more will join in. Right now, as it stands, and today is September 23rd, 2009, 3 years almost to the date of starting the foundation, we've made incredible leaps. Most of it is just a dream, but we are fortunate enough through hard work and personal sacrifice, financial sacrifices, to purchase the land, or I guess there's no purchasing a land, you lease the land, and the capital, which is accessible to transportation and to a lot of people. We've had the architectural design donated pro bono by an architectural firm in Atlanta, so Stanley, Beamans and Sears, which they are the group who are our first supporters and ardent supporters who've not only designed one design after a lot of research, but they've also have a plan B just in case we fall short on our funding goals. We've done the soil and environmental analysis and studies for the environment where the hospital will be located. We have a buy-in of the community, our neighbors. We can't be just intruders. We have to be good neighbors and good citizens. And we also have a good working relationship with the medical school, because that's the source for our support. While we're doing our fundraising and our creative ways of making the reality, our dream come true, we're also sending the medical missions to address the existing needs, because that need is not going to wait our building of the hospital. So this coming October, we're going to take in a medical mission in collaboration with Healing the Children. Yeah, why me? Even though I've thought about it a lot, and why not me again? And it's God's choice and God's will. The things that we do, the people that we meet, the problems we encounter, and the solution that we have happens for a reason. Sometimes it's beyond our understanding. I'm not trying to sound prophetic or, speak to God or anything like of that sort. But if you have a belief and a faith, these kind of things happen and change your life and affect your life, and you get inspired either through doing or through seeing others to do something unimaginable. Of course, like anybody else, this cannot be done without any financial resources. So we need everybody's support. And we try to work in a transparent kind of way. I know people, when they send money, they're not sure where the money's going, especially when it's overseas. And, I cannot convince everybody what I'm doing is for the right reason and the right cause. You just have to feel it, and you read about it. And if you connect, you're willing to give. And we're all volunteers, all the doctors and members of the board make a living on their own and have a family. This is what the cause that they believe in, and this is a non-profit venture. Every dime that goes, or the contribution that comes into this event or this cause, goes directly to provide service as well as building the hospital. Even if you don't have the financial means to support, as I said, prayer and well-wishing are important, but you can have other talent or resources, so you can make in-kind donations. There are people who are architects. There are people who are painters who have donated their paintings for auction. There are people who are builders who are willing to say, okay, I mean, I give you the money because of the economic situation, but we have the tools. Maybe we can help you build the foundation. So there are situations, it's almost bartering for the right cause. Well, the message that I have for anybody with a dream, no matter how big and crazy it may sound, and I'm sure you can attest to this, don't give up on that dream. It's not going to be easy, but you learn along the way to dust yourself when you fall, and we have to constantly remind ourselves why you're doing this, and which all of us, and I'm sure you do, doing what you do, you have to remind yourself, I'm not doing this for the money or for the glory. It's for a higher purpose. You may not know the purpose right then and then. When you see the impact of how you change lives, how you do what you do, make an impact, then you say, okay, maybe I understand the impact of what I do. Much the same way as a pediatrician, when you see kids, maybe very sick and you're not sure what's wrong with them, especially it's very challenging when they're nonverbal and the family dynamics is not ideal, but you believe and said, okay, I can make a difference. I can work with them, even though the family situation may not be ideal, but I know if we embrace them, not judge them, but embrace them and teach them and show them the tools, you can see the impact of your work as they grow, through time. These are kids with innocent heart and an open mind, and you can see them grow and stay healthy. So there's tangible stuff you can learn as a physician, as a pediatrician. It's not that we make a whole lot of money, which is good, but the reward comes in many ways. And last but not least, volunteerism. If we can inspire our current generation, but most importantly, as we are aging and our time is finite, but if we can teach the next generation and inspire the younger generation to not be cynical and jaded, but also to participate and to volunteer. You don't have to go to Africa to make a difference, or South America. You can help your own communities. There are kids living in poverty in your community. There are people who may not have anything to eat, need tutoring. So you can volunteer to do those kind of activities. So hopefully by seeing our story and our mission, we can inspire people to volunteer with us or any other organization of their choice with the belief and the views that they connect with, and make a difference in small little ways. You don't have to do anything extravagant, but anything that your heart tells you to do, we should get involved.